State Health Commander Catherine Morgan-Wicks, Director of Public Health Dr Mark Veach, and Donna Adams, Deputy State Controller. What we'll do is I'll hand to Mark once I've finished, and then to Kath for a vaccine update, and Donna can take any questions that there may be as well. Now, at the moment there are more than 25,000 active cases of COVID between New South Wales and Victoria, and the risk to Tasmania remains ever present. While we have strong border controls and quarantine processes and the vast majority of people follow the rules, there are occasions where this is not the case. Unfortunately, I've been advised that a 31-year-old New South Wales man arriving in Tasmania via Melbourne on Monday evening, despite his good-to-go pass having been refused, was placed in quarantine at the Travelodge Hotel in Hobart that night. Now, following a welfare check undertaken by the hotel security early Tuesday afternoon, the traveller was found not to be in his room. Tasmania Police were immediately notified, and a check of the Travelodge Hobart Hotel was undertaken to try and locate him, and also to confirm that all other current guests were accommodated in accordance with the accommodation register. Late yesterday afternoon at approximately 4:45, the 31-year-old was located by Tasmania Police at an address in the outer northern suburbs of Hobart. He was immediately returned to hotel quarantine, and additional security was allocated to him. The man has been tested overnight and through this morning for COVID-19. It has been confirmed that he has returned a positive result. Now, Dr Veach will speak more about the circumstances in a moment. I do want to say it disappoints me greatly that when the vast majority of Tasmanians do the right thing, day in and day out, people will blatantly ignore the rules and put others at risk. And I'd make the point that we've had some 13,400 people now through our hotel quarantine system, and there have been around 3 breaches. The 31-year-old will receive 2 fines totalling just over $3,000, one for breaching quarantine and the other for attempting to enter the state without the necessary approvals. Before I hand over to Dr Veach, I do just want to mention a matter with our borders. Public health authorities have continued to monitor the situation in other jurisdictions and continue to review our arrangements to help keep the Tasmanian community safe. Importantly, whilst we work on increasing our vaccination levels. Now, based on the assessment of the situation in New South Wales, Victoria and the ACT, further changes are being made to the risk level for these jurisdictions. From 12:01 a.m. tonight, so 1 minute past midnight, all of Victoria will now be classified as high risk level 1. Further, this will not be permitting travel to Tasmania from 9 Victorian local government areas with the highest prevalence of active cases. These 9 Victorian LGAs are Hume, Whittlesea, Melton, Brimbank, Moreland, Wyndham, Greater Dandenong, Casey and Maribyrnong. Any traveller who's been in any of these 9 LGAs in the 14 days before their proposed travel to Tasmania will not be permitted to enter Tasmania at this time. All other areas of Victoria will remain, or will be at high risk level 1, which is the same level as New South Wales. Now, travellers who've been in Victoria, not in any of the 9 no travel local government areas in the 14 days before their proposed travel, must apply to enter Tasmania. If approved, quarantine and other conditions will apply. Tasmanian residents, if approved to enter, may be eligible to undertake their 14 days quarantine at their home or a suitable premises. We've had the New South Wales trial, and we're now extending that to Victoria. The trial has worked, but it's now being extended to Victoria. If approved to enter Tasmania, to be eligible to quarantine at home or a suitable premise, a traveller from Victoria must have received 2 doses of COVID-19 vaccine and must have returned a negative test result from a sample within 72 hours of their travel to Tasmania, not be a case or contact subject to COVID-19 related restriction in the mainland jurisdiction, and be able to travel by private transport to their approved residence, as we have explained before. And they must be able to quarantine an approved residence that is standalone and semi-attached, does not share entrances, and they are quarantining by themselves. People undertaking quarantine, as I've explained, will be provided with a sign to place on the front door of the premises and will be subject to in-person and electronic compliance checks. And this will ensure that requirements for Tasmanian residents who enter home or suitable premises quarantined from high-risk mainland areas are proportionate to their risk of COVID-19. So to confirm, we now have all of Victoria, New South Wales and the ACT classified as high-risk level 1. But if you were a Tasmanian and you're outside of those 9 LGAs in Victoria, you can travel back as long as you are double vaccinated and you've had a test within 72 hours. Kath will say more about vaccination in a moment, provide an update on where we are, but I'll just make this point. With this positive case, there has never been a stronger reason for Tasmanians to step up and get vaccinated. We're doing a very good job at the moment, but it is important that that occur. And in terms of this case, I'd make the point that this is happening in real time. The positive result was received by Public Health at 11:16 this morning, and we are obviously working through with the contact tracking and tracing as we speak at this moment. Dr. Veets can provide more detail on that. I'll hand over to him.
Thank you, Premier. Yesterday afternoon, around mid-afternoon, Public Health was advised that a person who should have been in hotel quarantine was no longer there and was being sought by the police to be brought back to their quarantine. And as we heard from the Premier, they were found in the outer northern suburbs of Hobart at around about 16:45 yesterday afternoon and were brought back. On their way back, they were brought via the Hobart Hospital, where a test was conducted for COVID. Public Health had advised that that was important, that that was done, given that this person had spent some time in the community. We got results last night that we called an equivocal test, which is a low positive test, neither definitely positive nor definitely negative, but certainly a test that needed further follow-up. Because of that, we initiated some precautionary initial contact tracing last night in case the test subsequently confirmed positive. And today, as the Premier noted, I was advised about 11:15 that the test was positive. Our contact tracing team is active now, and they've identified a number of settings where contact tracing will be focused. Firstly, the plane that this person flew from Melbourne to Hobart on Monday night has been identified. That was JQ715 that arrived at about 8:30 on Monday evening. We will have the flight manifest and we will contact all the people on that flight. Having come out of Melbourne, it's quite likely that most of those people on that flight will already be in one or another form of quarantine. But of course, if there are people who are on that flight who've come from another mainland jurisdiction, we will identify them and assess them, and they will become contacts, either close or casual, and be quarantined. The flight, from the initial message that I have, is that the flight actually had a quite small number of people on it, so we don't expect there to be more than a dozen or so passengers on that flight, but we'll be able to confirm that tomorrow. We're also assessing the movement of this person at the airport and the people that they interacted with before they were transported with an appropriate quarantine bus and police escort to the quarantine facility when they came in on the flight. We're also in the process of identifying the contacts that this person had in suburban Hobart after they left quarantine, and those people will be quarantined and tested. This is all occurring right now as I speak, and that work will be substantially completed during today. Obviously, if there's any need to provide public warnings about exposure sites or locations of concern about transmission, I'll be in front of the cameras and advising the public of that need. So I might just leave it there, unless you have any questions about either this or the changes to the border arrangements.
Is the patient being cooperative with contact tracers?
The patient is being contacted by the contact tracers. I can't.
They've been spoken to yet, or whether
we had an initial conversation with the case last night to prepare for the possibility of needing more detailed information, and we're contacting the person again. Whenever we do contact tracing, we seek information from a number of ways. We often ask the same set of questions the same way or a different way of the cases when we interview them on successive days. We'll also seek information from other family members or people they were with. Sometimes we use other sources of information, such as closed-circuit TV at places like airports to verify people's movements. So we actually use multiple forms of information to get what we believe is the most correct account of someone's movements. And that can take time, and it can mean it can change. So one of the reasons why I hesitate to provide a definitive account too early is that as we get those extra pieces of information, the story can be clarified or even change a little.
Given that you know they've been to the hospital, do you have any special concerns that we may have a hotspot at the hospital?
No, I don't. We're aware that the hospital has been contacted and we've had assurance that the infection control procedures relating to the person's management when they were tested are fine.
Do you know any indication yet this person was actually out of the hotel and in the community?
We will be clarifying that through our contact tracing interviews that are being conducted now.
Do we know how the individual travelled from the hotel to the northern suburbs? Was it through private, public?
We'll be finding it out through our interviews with the case now. I do need to remind you that we have confirmation of this case barely 2 hours ago. So we're onto it, but all of that information, for the reasons I just explained to David, is incomplete at the moment, but we will get the information and we'll verify it in the course of the afternoon.
Do you know if the person, so he went into hotel quarantine on Monday evening and then it was Tuesday afternoon that it was discovered that he wasn't in the hotel anymore. Were there checks between when he went in on Monday evening and Tuesday afternoon, or is it possible that that was that whole time?
When people come into a hotel, they usually have a welfare check within an hour or so of entering the hotel, and I understand that occurred, but the details of that, as I've said a couple of times, we will verify in the course of our interviews and both get information from the case and also verify it from other sources.
How many other people are at the northern suburbs address?
We'll be getting that information when we complete our interviews.
So it's too easy to say how many close contacts or even casual
I can't
contacts.
tell you how many close contacts because we will be getting that information in the course of the interviews that we're doing now.
Can you tell us which suburb that is?
No.
Why not?
There's no public interest in providing the suburb the person is in unless there's a risk to the public in that suburb. The interviews that we're conducting at the moment with the case and their contacts will help us identify whether there's a sort of risk that means we need to identify the suburb they're in because there's a public health risk. If there's no public health risk associated with that person's presence in a suburb, I wouldn't breach their privacy. As you know, when there is a public health risk, as in the case of the IGA at Newnham, we were very quick to come out and tell the public about where that site was. So that's the criteria for those sort of disclosures, the fact that it actually assists the public to manage the risk of COVID.
Can you argue though it is in the public interest if this person's tested positive and was at a northern suburbs address? I mean, wouldn't people in that particular suburb need to know?
If anybody anywhere in Tasmania is concerned about themselves having COVID, please go and get a test and please get vaccinated.
Is it just that one location that you're looking at, or is there multiple locations that this person visited?
We're in the process of conducting interviews with the case and their contacts as I stand here and talk to you. I can't tell you the outcomes of those interviews until they're completed.
How was it that the man was able to walk out of the hotel quarantine?
I can't comment on how he left the quarantine. Public Health doesn't take responsibility for the management of security in quarantine hotels.
Do you know if this patient has tested positive to the Delta strain?
It's very likely that this person has Delta strain. It's almost the only strain occurring in Australia at the moment.
You know, obviously it's very early stages. Do you have an idea when you'll have something to say about where this person's been? Is it a few hours? Is it tonight?
We will gather information in the course of the afternoon. If there are public exposure sites that we need to announce to the public, I'll make sure they're announced as soon as possible.
If there is another positive case to come out of this situation in Tasmania, will this mean any sort of lockdown?
I'm not going to do a what if. Obviously, when we investigate the case, we have very experienced public health practitioners who gather the information and they assess whether that information is likely to be correct and whether it indicates a wider risk to the community. If there was a significant risk or evidence of community transmission to the community, that's the point at which we start thinking about more severe measures. But at the moment, we need to gather that information. I mean, I understand your absolutely correct right to ask as tough a question as you like about this case. But I'm being completely frank with you in telling you all of the verified information that's available to me at the moment. And as I've done for the last 18 months, as further information that comes out that's relevant to public health, public risk, I'll disclose it. You'll also know that I'm fairly firm on not giving up information that identifies people or stigmatises people or locations unless there's a public health need to that. I think that's incredibly important as part of maintaining public health trust and cooperation of people in our investigations.
That this person's now a positive case, will they be moved from the travel lodge to another location?
Yes, I expect their clinical situation will be assessed, and it's likely that they'll be either moved to the case management facility at Fountainside or the Hobart Hospital, depending upon their clinical needs.
Okay, might move to Catherine Morgan.
Thank you, Dr. Veach. And just quickly in relation to that clinical treatment and assessment of the case, that's underway now. And because the case is actually in quarantine, our two options are the Fountainside Case Management Facility or the Royal Hobart Hospital. And that transfer, once that clinical assessment's been undertaken, will occur later today. In terms of testing, and I'll just briefly mention testing, as Mark has gone through and as no localised risk has been identified, it is testing as normal, with the main message that if you do have cold or flu symptoms, to please arrange a test. In terms of vaccination, over the weekend we passed a significant milestone of 80% of people aged 16 and over having had a first dose of the vaccine. We also have one of the leading rates in the country of people fully vaccinated with more than 65% double dosed. We have around 30% of 12 to 15-year-olds vaccinated, and pleasingly this is growing rapidly, with the Hobart Youth Clinic this weekend at PW1 looking at around 1,600 appointments, but you can still get a booking. Now this is great progress, but we need to keep the momentum going to hit our target of 90% of people aged 16 and over fully vaccinated by 1 December. We are in week 34 of the vaccine rollout, and close to 352,000 Tasmanians have had at least one dose, and more than 284,000 Tasmanians are now fully vaccinated. As at 11 October, we have delivered close to 652,000 doses across Tasmania, with more than 361,000 doses in state government clinics and close to 291,000 doses by primary care providers. There are still around 85,000 Tasmanians that haven't been vaccinated, including 22,000 people aged over 50. To these 85,000 Tasmanians, throughout October, we have thousands of appointments still available in state-run Pfizer clinics and more again at the 105 GPs and 100 participating pharmacies. Please don't wait any longer and get vaccinated now. Walk-ins are now accepted at all of our state-run vaccination centres. Bookings are encouraged, so you don't have to wait, but you can walk in and get vaccinated without an appointment. For clinics this week and next, we have appointments available at our ongoing state-run Pfizer vaccination clinics in the Hobart area, at Blunsdon Arena, PW1 in Salamanca, and the Hobart City Centre Vaccination Clinic on Elizabeth Street. In the north and northwest, appointments are available for next week at Launceston's Door of Hope, Burnie Arts and Function Centre, Ulverston Rowing Club and Devonport Surf Life Saving Club. We are also continuing to ramp up activity further in regional areas with lower vaccination rates to ensure that everyone has the chance to receive a vaccine. In the next 7 days, we are running pop-up clinics at Huonville Town Hall today, Brighton Civic Centre from tomorrow to Saturday, Oatlands RSL this Friday, the 15th of October, Ooze at the Central Highlands Community Health Centre on Monday, the 18th of October, Berrydale at Mona on Monday, the 18th of October, and New Norfolk District Hospital on Tuesday, the 19th, and Wednesday, the 20th of October. After that, we're also bringing pop-up clinics to Smithton, Scottsdale, Georgetown, and Wynyard. If you live in these areas, please take the opportunity to get vaccinated. As I said before, walk-ins are now welcome at all of these clinics, but bookings are still encouraged if you want to avoid waiting. We are also partnering with the Royal Flying Doctors Service to provide mobile clinics in small population townships across the north, the northwest, west coast and Central Highlands. And the program for this is currently being finalised, and further details will be announced shortly. So appointments are also available at this weekend's youth clinic at the PW1 Vaccination Centre in Hobart for people aged 12 to 17 years. If you have children aged 12 to 17 years, please bring them down and walk in and get your children vaccinated, and you too if you haven't already. We have appointments for our outer and northern outer suburbs in terms of Bridgewater this Thursday, Friday and Saturday at our Bridgewater clinic with plenty of spots available, so please walk in. We also have appointments, a lot of appointments available at Berrydale, Moona and our New Norfolk clinics. So to conclude, every single day we face the risk of Delta, particularly as we've seen today. Our teams are working incredibly hard to keep Delta at bay while we vaccinate across Tasmania. So for all Tasmanians that are yet to vaccinate, do not wait for Delta to turn up in your community. Please make vaccination your number one priority.
Will there be any changes to protocols at the Royal Hobart Hospital now that there's been a case go through there?
No, there won't be. So in terms of the assessment, if we do have a single COVID case join, that is still at one of our lower escalation levels at the Royal Hobart Hospital, and further levels are then triggered by the number of cases that are admitted.
There will probably be an increased level of anxiety, and particularly in the northern suburbs, as this event unfolds. Do we have the ability to ramp up testing in affected suburbs?
Yes, we do. So we will assess, so depending on the results of the interviews that are carried out further today, we'll assess the need for any localised or pop-up testing if a localised risk is identified.
Are you expecting there to be any sort of lag in the vaccine uptake as we near that 90% target?
So we've always said that reaching that goal of the 90 and probably that last 15 to 10% is the hardest that we'll actually have to cope with in the vaccination rollout. But that is why we've redoubled and intensified our efforts, particularly with the regional pop-ups and with also our partnership with the Royal Flying Doctors Service and their vaccination bus to get out to those areas where particularly transport may be an issue for people concerned to get a vaccination.
Do you have any update yet on that bus and which specific locations it will be going to and when?
Yes, so we'll be publishing the full itinerary for the bus and pushing that out via our health media.
Are you investigating how the man left quarantine? Is that with Tasmania Police, or is that a government issue?
At the moment, Tasmania Police have already provided this individual with 2 infringements, one for breaching the border controls and the second one for breaching quarantine.
And do you know how he left quarantine?
We're conducting a review with our stakeholders to determine the circumstances surrounding the breach of quarantine. But at the moment, it's important that public health actually take the response to this situation so that the appropriate contact tracing is conducted, and then the review will be obviously progressed.
Do you have any early indications of if he was just able to walk out, or if there was some other means of him getting out of the hotel?
Police responded to the report that this individual had left the quarantine in a timely manner, and he was located a short time later. He was transported back to the Royal Hobart Hospital for a test and then back to the quarantine facility. We'll look at all the circumstances surrounding this individual's movements after the public health response has concluded.
So was the report to police that he wasn't in his room anymore, or was it that someone had seen him leave?
As Dr. Veach has said, this is early stages. We had a report that this individual had left the quarantine hotel. Police conducted a number of inquiries and located him a short time later, where he was returned to hotel quarantine.
Do you have any concerns that the police who responded to this may have been exposed to the risk of COVID?
Tasmania Police always take a cautious approach when our officers are dealing with anyone that we identify as being positive, and we've taken that cautious approach last night, and we'll take public health advice in relation to how we manage those officers moving forward.
Quarantining or being isolated? Or
At the
like
moment,
that?
public health will conduct their contact tracing and obviously interview our officers to determine the level of risk, and we'll take the public health advice.
Do police monitor hotel quarantine, that they're sticking to the measures that they need to have in place?
Domestic quarantine is actually is private security, obviously with police checks. And we've had a very successful program in terms of our hotel quarantine program, with very minimal concerns around the way in which quarantine has been managed in those facilities.
So there were no concerns about this particular facility before this happened?
No, there wasn't.
It'd be correct to say I think there's been one other incident of somebody slipping out of quarantine in the last 18 months, is that right?
I don't have the detail in relation to that particular breach, but you might be right.
And can you give us the details, the precise details of what the infringement notices are for and how much they are?
Yeah, the infringements are each $1,557, so there's two of those infringements. One is for attempting to enter Tasmania without a G2G pass or the appropriate authorisation, and the second is for leaving quarantine, again, where the applicant was required to maintain quarantine requirements.
Just to confirm, this is the travel lodge in town that we're talking about, not the one at the airport?
That is the travel lodge in Hobart.
Questions of the Premier?
Thanks, Don.
Why was this traveller, if they arrived at the airport without a G2G pass, why were they not turned around and sent back to Melbourne?
They arrived at 10 o'clock at night. As I've explained in here before, under those circumstances they'd be placed on the next available plane, but obviously coming in on the last plane at night, they were taken to hotel quarantine.
How concerned are you about the level of security at the travel lodge, given this was able to happen?
Well, I think what we need to do is allow police to engage with Communities Tasmanian to understand exactly what has happened and how this individual has absconded. That's not clear at this particular time.
Was the expectation that he would be taken to the travel lodge and spend 14 days there, or what was the expectation? Was he going to be flown back sooner than that?
If he'd received a negative test, he would have been sent back.
Are you disappointed that something like this can happen? You know, that somebody can treat the rules with such contempt and potentially expose people to risk?
Well, look, of course I am very disappointed. But again, I'd make the point that my understanding is, in terms of this individual, that they'd been knocked back twice in terms of their good-to-go pass, and they'd chosen to attempt to enter Tasmania on the last flight of an evening. They were picked up at our border, so our processes work, and they were taken to the travel lodge. Now we need to understand what has occurred at the travel lodge and how they've managed to abscond.
Is there any work happening with the travel lodge at the moment on their security, given this situation?
Of course, there are conversations underway.
What are they about? About getting extra security guards, or?
Well, again, once we understand exactly how this individual has absconded, then we'll look to take what steps we can. But I would make the point, these are hotels. They are not secure prison facilities, and we need to understand just how this has occurred.
Issues, if you've got a moment.
I do.
Are all of the members of your government vaccinated, or have they had at least one dose of the vaccine?
I haven't bothered to ask them. They're all responsible people. I make those decisions.
You don't have an expectation.
Well, can I just make the point, we haven't mandated that members of Parliament need to have a vaccination, but as I've said, they're all responsible people. They'll make good choices, I'm sure.
Are you encouraging them all to be vaccinated?
I'm encouraging all Tasmanians to get vaccinated.
How do you know if a member of your parliament doesn't want to get vaccinated and won't get vaccinated? Will you do anything to prevent that?
Look, is all of you vaccinated? Mm-hmm. Oh, that's good. Actually, I feel much safer. No, look, at the end of the day, in terms of mandatory vaccination, we've made our position clear on that in terms of the health system, in terms of aged care. Currently we're considering what steps, if any, might be taken in terms of looking after those that I consider most vulnerable, those that are NDIS clients. But that decision hasn't been made as yet. I would hope that with the information that's being provided, that there is no need to mandate any further than that.
If you're asking all Tasmanians, though, to have a COVID vaccine, wouldn't you expect that members of Parliament would, to set an example?
Well, I'm certainly making it very clear that I would expect members of Parliament to be vaccinated, and I would hope that they would make that choice.
Intending to guillotine debate on the gaming markets reform, there's some suggestion that you're going to get this through by the end of the week. Is that the case?
No, look, my expectation is that this will probably run into the coming parliamentary week.
We're expecting, we've got 267 ventilators in the state, and we're expecting 100 more from the federal government. I think when the state government first mentioned that was about 6 weeks ago. Do you know when those ventilators will arrive?
Look, I think I've got the best person in the room to actually answer that question. I'm happy to hand to Kath in a moment.
Do you know how many Tasmanians are waiting to come home from interstate at the moment?
My advice yesterday was that there were around 80.
Take that question from Kat.
So in relation to the 100 extra ventilators, that's actually been procured via the Commonwealth. So we're working with them in relation to the delivery, noting that there are other states also that are working with the Commonwealth for ventilators that have active hospitalisations and the need for those ventilators. So I'm not concerned given the number that we do have in the state, and once we, or if we do need them, that they'll be provided.
Do you have like a timeline of when you're expecting to get them there?
No, I don't currently.
Just a general question. I know we've got a lot of unknown unknowns, but is there a timetable? Is it we're just going to get more information as it becomes available? That's the likely outcome.
We'll provide an update early evening at the latest.
Sorry,
We'll just need to see how the
as more information becomes
available. Certainly, if there's any public exposure sites, we would certainly make them known as soon as we know. But all the work about defining the contacts and the plane and so on, I think that an update either this evening or tomorrow, when we're confident that the information won't change.
Thank you.
That's all. Yeah.